So the Yanomamo were a culture where we found that really cultural differences were very, very important to study because that was really the only way for someone to get a perspective on some of these things that happen outside of the norms of society, right? So uh, let's talk about things that can affect mental illness, that can bring mental illness about. There are two basic large categories of factors. One is a biological factor, right? Like, so your genetics, what you're born with, what your parents had, and what plays a large role in something like this is your genetic predisposition. That's a very important word. Genetic predisposition means that because of your genetics, you have a greater percentage chance of developing a particular disorder than somebody in the general pool of society. So, for instance, an example of this would be if you have parents that one parent that was an alcoholic, your percentages of getting becoming an alcoholic are higher than people who don't have any alcoholic parents. And then subsequently, if you have two parents that are alcoholics, you have even a more increased chance, and that's because of genetic predisposition, right? Doesn't mean that you're absolutely going to become an alcoholic because, of course, you can have control over your intake of alcohol, so you could stop that from happening. But your chances are much greater if you do drink than someone in the general population, right? So those are genetic factors. And what we found through studies, and they're gaining more and more knowledge in this area, is that many of the disorders that we talk about, such as schizophrenia and depression, do have a genetic component to them, a genetic predisposition. Second thing is environmental factors. So there are things in the person's environment that have an effect on the development of mental illness. Things such as deficits in cognitive functioning, deficits in the processing of different stimuli, like if someone is impaired with their hearing, their vision, those type of things. Problems dealing with stressful and emotional situations, diagnosis such as PTSD, post-traumatic stress disorder, that comes about because of a stressful situation that you have in your life, and because you have some predisposing conditions, you can develop this disorder, post-traumatic stress disorder, right? So there are those two different types of influences on whether or not you eventually develop a mental disorder. So let's talk about assessment of mental disorders. We use something called the DSM-5. The DSM-5 is sort of the Bible of diagnosis, right? All the psychiatrists and psychologists use this. And it's developed by a group of scientists that come up with an agreement on different diagnoses. And it looks a little bit like a cookbook, right? So if you look at a particular disorder, let's say major depression, it would have a listing of symptoms that you would see in someone with major depression. And it would probably say something similar to if you see 7 out of 10 of these symptoms, then you give this diagnosis. So that's a very common way that things are listed in what we call the Diagnostic and Statistical Manual, fifth version. And that was fairly recently updated, right, a couple of years ago. And what you find is there are symptoms that match the disorders, right? And there's approximately 300 different diagnoses that you find in there. So let's talk a little bit about clinical assessment and how that is done when someone has to be analyzed. Well, the first thing is via neurological testing. And neurological testing is kind of ruling out some of the underlying potential biological basis of the disorders, right? So in order to do that, there's a couple of different type of tests that it can be given. An MRI of the brain functioning is something that can be done to see if the brainwave patterns are quote unquote abnormal. Um, Also, you can go into something called a PET scan, which is something that's a little more sophisticated than an MRI and sort of gives a slice by slice presentation of the brain and how it's functioning, right? And then also, as part of a neurological scanning, they would give you something called a Bender Gestalt. A Bender Gestalt is a paper and pencil test, right? So they give you examples of things that you should be able to draw easily. and then they ask you to then draw them, reproduce them on a different piece of paper. And people with neurological processing disorders make particular mistakes on that paper and pencil test that indicate they might not be processing things in the proper manner. So that's kind of a really important way of looking at mental disorders, because if there's an underlying neurological disorder, sometimes it will not matter what psychotropic drugs you treat with. And talking therapy might not be any good if there's an underlying neurological process that cannot take place. As a for instance, for something like autism, you can't give psychotropic medication to address autism, or what we would call mental retardation, or um, developmental disability. You can't medicate that to make it better. Right? So you'd want to assess what the neurological processing is going on. Second thing that we use when coming into the hospital to, analyze what exactly direction we should take in trying to treat someone is called the clinical interview. The clinical interview is the gathering of information about a person's past, how they function in the past, their beliefs, their attitudes, right? Their presentation, how they present. Excuse me. All of those things are extremely important when you're trying to put together a clinical picture. So when the person comes into the hospital to get an analysis, the triage department will ask questions and will try to assess how the person is functioning. So you're talking to the person about how they feel to try to get a diagnosis. You're looking at their family history in order to get a diagnosis. That's another thing that can give you an indication. Like we talked about, genetic predisposition is very important. And then we try to get a fix on whether or not the person has is grounded in reality, or their thinking is fantasy, and what their attitudes are about treatment and participation in treatment. And lastly, also how someone presents, like, is their speech of normal pace, or are they pressured in their speech, or is it loud or soft, or is it are they disheveled when they present, or are they neatly groomed? All of those things can have an influence on how we diagnose someone. Right? So the other thing that we want to talk about in terms of psychological evaluation when someone comes into the hospital would be the uh, psychological tests that can be prescribed. And this is something that you guys looked at in some of your articles. The MMPI is a very common thing that is given. That's a personality inventory, if you remember. And it's a modified version of that. So there are quite a few questions to be given. It's not always appropriate if someone is too psychotic or disorganized to take it, but many times we try to give the person an MMPI to clarify diagnosis. The other type of tests you can talk about are projective tests, similar to the Rorschach, the Inkblot test, or the TAT. Those type of tests, which help you to sort of clarify your diagnosis. And again, I want to say that diagnosis is such an important component of treatment, because if you start down the wrong treatment path, you can end up either medicating or putting someone into the therapy that is really not the appropriate venue for them. And when you do that, it really can be harmful and potentially delay recovery from mental illness. So, diagnosis of mental orders over a lifetime. There are quite a few diagnoses of anxiety disorders, right? About 32% of all the disorders diagnosed will be anxiety disorders. Um, Mood disorders are about 28%, almost 30% of the disorders diagnosed. Um, Alcohol use and drug use disorders are also very common now. And the diagnosis, again, is very, very important and can include components of different aspects of disorders. So there's something called a schizoaffective disorder, which means that you have elements of both schizophrenia or thought disorder and affective or mood disorder. Right? So let's start to talk about some of the specific disorders that we want to keep an eye on in order to get some definitions and potential treatments. So the first category we're going to be looking at in specific disorders are the anxiety disorders that I just mentioned, right? So anxiety disorders are very, very prominent. They're the most commonly diagnosed disorders. And one of the most common diagnoses that you'll find with the anxiety disorders is generalized anxiety disorder, abbreviated GAD or GAD. And that's defined as excessive and unrealistic worry about almost everything. It's feeling something bad is going to happen all the time. And this has to be, on most days of the week for about 6 months period of time in order to get that diagnosis. And usually, when someone presents with GAD or generalized anxiety disorder, they present some psychological symptoms. Those symptoms include irritability, the inability to stop worrying about things, and always feeling upset and agitated, right? The physical symptoms that are found associated most commonly with this diagnosis are restlessness, fatigue, always being tired, and aches, body aches are very, very common with this diagnosis because you're functioning in tension and pressure all the time, which is not healthy. What type of treatment do we give for this type of anxiety disorder? Well, it turns out that psychotherapy and specifically cognitive behavioral therapy with this type of disorder can be very, very effective. If any of the anxiety functions that a person has learned, luckily, can be unlearned. So that's why cognitive behavioral therapy can be extremely effective in treating that. Sometimes antidepressants are prescribed for anxiety because the many times there is depression that results from high anxiety levels, and so this helps to treat both the potential for depression as a result of the anxiety, and it has some impact on treating the anxiety. And also, many times, benzodiazepines such as Xanax or Ativan is prescribed because that does help to reduce the immediate physiological response that leads to anxiety. Problem is, of course, dependency on these drugs does run at a fairly high rate. So the good thing is that we are becoming more sophisticated at our treatment of anxiety disorders. The bad news is that unfortunately they're becoming much more common in this day and age. And as you know from this year, we all have operated from a kind of a level of anxiety that's probably not healthy. But hopefully going forward, we'll really strive to take care of ourselves. That's really, really important. So, one of the things that's most effective in addressing anxiety disorders is to organize your life into a way that you can feel sort of reward yourself and feel good about things that you're doing in regards to your health and psychological wellness, things like physical exercise and meditation and relaxation. That really, really helps people to address anxiety disorders. Well, on to the next anxiety disorder that we want to talk about, which is panic disorder, right? And this is defined as recurrent and unexpected panic attacks. Worrying about having the next panic attack takes over you because you know you're prone to panic attacks. So it's almost like the anticipation of a panic attack can bring on another panic attack. Uh, a panic attack, if you've never had the pleasure, which I have, unfortunately, but it's an intense fear or discomfort. It's accompanied by heart pounding, sweating, trembling, shortness of breath, chest pains, nausea, and being dizzy, and it feels like you're dying. And the truth of the matter is that it's a very, very uncomfortable thing, and it really does imitate the symptoms of a heart attack. So very, very uncomfortable. And someone with a panic disorder that is prone to that type of reaction, fears that it will continue, and it's just a very, very uncomfortable disorder. What type of treatments? Well, it's similar to the treatments that I just talked about. Psychotherapy is very effective in treating this. Sometimes hypnosis can be helpful. Sometimes teaching of relaxation and meditation can be very helpful in helping a person treat panic disorders. And again, the medications tend to be the same. People with panic disorders oftentimes take antidepressants, such as Prozac or Paxil, and they also generally are prescribed benzodiazepines such as Ativan or Xanax in order to address those acute panic attacks. So occasional use of benzodiazepines in small doses is not considered potentially addicting, but if you use them more commonly, it does fall into that category. Also falling under the anxiety disorders, believe it or not, are phobias. Now, phobias are an intense and irrational fear that's out of proportion to the potential danger of a situation, right? So we're talking about um, something like there's a few different categories that you might want to fit in there. Social phobias are one category, and that's an irrational fear of performing in social situations. So people become extremely socially anxious to the point where they uh, become agoraphobic. They pull themselves out of society. They can't find a way to interact with anybody in their world outside of a small little bubble, and that can be extremely debilitating. Um, Another type of category of phobia is a specific phobia. So, specific phobias include things like fear of heights, fear of spiders, arachnophobia, a famous one, and fear of enclosed spaces like claustrophobia. Those are very specific phobias that are attached to a specific situation or stimuli, probably came about because of classically conditioned situations that we talked about, and we may not even know where it came from. Maybe just lying in our subconscious, this association has been made. But it is true that these can be either extremely debilitating or not that debilitating. It all depends on how these are treated. So, what's the most effective treatment for these type of phobias? Well, luckily, again, the treatment, there are some good, really good treatments for this type of phobia, any of these type of phobias. Phobias are learned behaviors. We're not born with phobias. We are taught to fear these things, to make these associations. So the good news is anything that's learned can be unlearned. Cognitive behavioral therapy is very, very effective in treating this. This is when you change negative, distorted beliefs and substitute more healthy, realistic beliefs about how you attach to certain stimuli, right? And then you have to practice those newly acquired skills. So this is done many times in treating phobias through something we call exposure therapy. And one of the most popular ones was developed by Joseph Wolpe, and that is called systematic desensitization. And systematic desensitization, basically, you build a hierarchy of the least anxiety producing stimuli and to the most, right? So if you have a fear of snakes, as a for instance, you'd start working with the therapist by saying, well, a picture of a snake makes me a little anxious, right? And then if a film about a snake makes me a little more anxious, and then being in the room with a snake and then actually touching a snake, that would be your hierarchy, right? So the therapist would then train you at each step of the way to relax in the proximity of all of these stimuli. So they start with having you view a picture of a snake and then train relaxation, then a movie and then train relaxation, and then be in a room with a snake and train you to relax. And finally, they train you to be in an atmosphere with a snake where it was actually touching you and you'd be able to relax. Now, you may not believe it can happen, but pretty much you can learn to be relaxed around any particular stimuli. So that's the good news. So that's called systematic desensitization. And one of the things that's come about recently is that people have started to use virtual reality in order to train relaxation to some of these stimuli. And that's been very effective where it's been able to be used. So look for that to come about as a technique in the future to treat phobias more and more. Also, there are sometimes are again drugs prescribed, anti-anxiety drugs, such as the benzodiazepines I talked about, such as Xanax, or sometimes there's something called Boost Bar that can help to lower anxiety. Also, you find that people with severe phobias can be prescribed antidepressants. Once again, these phobias can run the gamut from being a little bit afraid and really not having that much of an effect on how you feel to being extremely afraid and having it be very unpleasant. And having people like not being able to function in their lives because of their phobias. The next sort of anxiety-related thing we're going to be talking about disorder is OCD, or obsessive compulsive disorder. Obsessions are really thoughts, persistent and recurring irrational thoughts and impulses, right? So you have an obsession, a thought that keeps playing over and over again in your head, and because of that, it drives you to the other part, which is the compulsions. Compulsions are ritualistic behaviors such as counting to a certain number or hand washing incessantly, and those things sort of chase away the demon of the thoughts, but usually it's only temporary, right? So obsessive compulsive behaviors, again, they run the gamut, right? It can be something that is not that debilitating. Like an obsessive compulsive behavior would be something like if you go to the gas station and you like to land on a even number. That's one of my little OCD things, right? So that's harmless, and if I don't land on an even number, it's not like the world's gonna fall apart. It's just something I like to do. But some people with OCD are so obsessed with the idea of, did I lock the door? Did I turn off the stove? Did I turn off all my electronics? Many people in that have it that severe, it keeps them from being able to function at all, because as soon as they go to leave the house, they have to check the door handles again, and repeated behaviors like that. So how do we treat that type of obsessive compulsive disorder? Well, again, usually you do it through exposure therapy. So you make the person, do it once and not go back to check, and you hold their hand through the process of showing them that nothing terrible is going to happen if they don't do their obsessive compulsive behaviors. Also, using cognitive behavioral therapy is oftentimes very helpful for that, where you replace some of your irrational thoughts with more rational ones. And many times, if it's a severe case, you will find antidepressants or anti-anxiety medications being prescribed. That is possible. All right, let's talk about PTSD. PTSD is uh, you know, a disorder that is very common when you're talking about experiencing something, a traumatic event, a very traumatic event, post-traumatic stress disorder. And what it basically means is that a person that experiences PTSD is stuck after witnessing an event like a death, or being in wartime, or being in a severe accident, and they can't sort of move on with their life. They can't process it in the right way. So a lot of times the person has reoccurring nightmares. They have intense fear. They have severe anxiety, many times panic attacks, and a lot of times it's accompanied by substance abuse disorders, because people try to self-medicate because it is so aversive, the reaction that you get. What type of treatment do we have that's effective? Well, cognitive behavioral therapy, again, replacing some of the thoughts, thinking about the events that you have experienced in a different way. Sometimes that can be very helpful in the processing. Many times antidepressants are prescribed. Sometimes things like Valium, or again benzodiazepines, are prescribed. Um, Recently, there is some looking into the prescription of medical marijuana for PTSDs. In some cases, have been effective, and also they've talked about new studies with hallucinogenics such as ketamine, that are being proposed as potential treatments for post-traumatic stress disorder. Now let's talk a little bit about the eating disorders, and then we'll finish up for today and go to our next and final film. So the eating disorders is really what we call a Western civilization disorder.